Now we're going to begin the respiratory system. The respiratory system is a system that brings oxygen to every cell in the body while simultaneously removing carbon dioxide from every cell and returning the carbon dioxide to the external environment. The functions of the respiratory system include: number one, it allows gas exchange between the air and the blood. Number two, it moves air to and from the exchange surfaces of the lungs. Number three, the protection of the respiratory surfaces from water, temperature change, and it actually defends the tissues from pathogens. Number four, it provides and produces sounds like singing and speaking. And number five, it allows the olfactory sensation of smell. There are two main divisions of the respiratory system: the upper respiratory tract, or the URT, and the lower respiratory tract, the LRT. Here are some illustrations showing you both the upper respiratory tract and the lower respiratory tract, and then an in-depth look at the actual alveoli, which is the exchange surface to put oxygen to the cardiovascular system and remove carbon dioxide from the cardiovascular system and expel it out to the external environment. Let's begin with the upper respiratory tract. There are a few key parts of the upper respiratory tract: the nose, the nasal cavity, the nasal sinuses, and the pharynx. Let's go over the nose. It's the primary passage for airway entry. About 99% of breathing occurs here. Cranial nerve number 1 allows a sense of smell. Asthma is a major issue in the U.S. It's an inflammation of the respiratory system, and it causes as many as 10 million sick days a year in a school year. Tylenol is a painkiller, acetaminophen. It does not thin the blood or cause nosebleeds. However, it is very tough on the liver in large doses. Next, the nasal cavity. It includes 5 bones: the maxillary, the nasal bone, the frontal bone, the ethmoid bone, and the sphenoid. Know those bones. Now the nasal sinuses. They have the mucosa. They prepare warm air to travel from the upper to lower tract for lung entry. The air that comes through the nose is healthier than from the mouth because it's filtered through the nasal hairs and the mucosa. The larynx is the throat. It's a muscular passageway shared by the digestive and respiratory systems that allows us to swallow food and helps swallow food. Here's an image showing you the whole system, and we can see the upper respiratory tract here, the nose, the nasal cavity, the nasal sinuses, and the pharynx. Now let's begin the lower respiratory tract. It includes the larynx, trachea, and lung. The larynx begins at the end of the pharynx, and it's located between vertebrae C4 to C6, and it's responsible for sound. Kids have a smaller folds in the larynx, the voice box, and they make high-pitched sounds, but after puberty it enlarges and the voice deepens. Phonation is the production of sound by the larynx. The larynx also is called the voice box. Next is the trachea. Another common name is the windpipe. It's a tough, flexible tube located between vertebrae C6 to T5, and then it divides into right and left bronchi. Finally, the lung. It's the number 1 respiratory organ that takes deoxygenated blood from the heart and returns oxygenated blood from the heart by expelling carbon dioxide. It is divided into 2 lobes that break down into bronchioles and then to alveoli sacs. The alveoli is where gas exchange actually takes place. Here we see an image of the whole upper and lower respiratory tract, but on the right we see the larynx, the trachea, and the lungs. And in the lower left-hand corner, we see the bronchioles and the alveoli. And again, the alveoli are where gas exchange takes place, where we pick up the carbon dioxide to be returned through exhalation and bring oxygen onto the red blood cell through the cardiovascular system. Pulmonary ventilation is actually breathing. It's the movement of air in and out of your lungs. Inhalation is the movement of air into the lungs. It uses 2 muscles, the diaphragm, and that's located behind the stomach and under the sternum, and the external intercostals. Those are the muscles between the ribs that force air into the lungs. And then exhalation is the movement of air out of the lungs. It uses three muscles: the transverse thoracic, the internal intercostals, and the abdomen. Vital capacity is the maximum amount of air that you can bring in and out of your lungs. Total lung capacity or volume for males is about 6 liters, and for females, total capacity or lung volume is about 4.2 liters on average. Residual volume is the amount of air remaining in the lungs after a maximum exhalation. Lung cancer is the #1 common cancer. It takes many years of smoking to develop. About 1,500 people die yearly from secondhand smoke alone. Oral cancer is another type of cancer. It's usually caused by chewing tobacco, and it enters your mouth's gum wall vessels. It may cause surgical removal of the mouth and throat in extreme cases. There are some causes of lung cancer. The 3 main causes of lung cancer include: 1, smoking. Smoking causes about 80% of all lung cancers. Cigarettes contain over 4,000 chemicals. First, tumors develop in the lungs or lymph nodes. Cancer can spread to any part of your body when it's malignant. And in 1993, 3,000 people died from secondhand smoke. Men who smoke are 20 times more at risk for cancer, and women are 12 times more at risk for cancer. The next few images will show you illustrations of lung cancer and actual cancer. A second cause of cancer is radon. Radon is a chemical. It's a radioactive gas found in rocks. 15,000 Americans die yearly from residential radon leaks. Radon is odorless and colorless, and exposure is only detectable with special devices. We don't need to worry about this in South Florida because we're on coral rock here. A third cause of cancer is asbestos. They're microscopic filaments or fibers that can collect in the lungs and cause lung cancer in later life. Symptoms of lung cancer include: 1, constant coughing; 2, hoarseness; 3, coughing up blood; 4, weight loss; and 5, chest pains. Here's an illustration showing how radon can seep through the fractured bedrock, and homes with cellars are vulnerable to radon gas leaks. Here's an image of asbestos. They used to use it in ceiling tiles and in different building products because it was supposed to prevent fires. Now let's cover the treatments for lung cancer. They include 3 things: surgery, radiation therapy, and chemotherapy. Usually the first part is diagnosis, and they use a bronchoscope. It's a chest x-ray that shows an abnormal spot in your lungs, and usually in that process a small tube is inserted from your nose into your stomach. Asthma is another lung disease, and with that lung disease it causes difficulty breathing by the narrowing of the passageways. It occurs mostly in children, and about $3.2 billion is spent every year treating asthma. It's the #1 reason for hospital visits in kids under 15. Symptoms of asthma include swelling of the lungs' internal walls, tightening of the muscles, increased mucus secretions, and wheezing. It's a sound from the lungs. 3 major causes of asthma attacks include respiratory infections or colds, allergic reactions, and cigarette smoking. Treatments include anti-inflammatory drugs and bronchial dilators, what we know as inhalers. Here's an illustration showing you a normal airway passage and then an airway passage with reduced due to an asthma attack, and also showing you inflammation and bronchial constriction. That concludes the respiratory system.